Hey, everybody. Welcome back to the Startup Sense podcast. This is your host, Jonah Lupton. As always, we have a great episode for you today. On the phone from Cambridge in the UK, we have Dr. Muhammad, and he's going to tell you how to pronounce his last name. I don't want to butcher it. But he is the co founder of a company called Patients Know Best. And essentially, what they are doing is creating a patient controlled medical records system. They're mostly in the UK right now. They are in 5 or 6 other countries, including the US, although they really haven't scaled to the US yet. Hopefully, they're coming soon because what they're doing really could kind of change the landscape of the healthcare system and provide better efficiency and transparency and everything else that patients are lacking right now. And for myself, dealing with the blood clot the last year, I know that firsthand. The company is approximately 42 employees across 12 countries. So we'll talk about why they are so distributed. And now let's welcome the doctor. How are you, sir?
I'm good, thank you. How's your Monday going?
It is going well. We are preparing for a blizzard tomorrow. It is March 11th or March 13th. So tomorrow will be the 14th, and we're supposed to get 12 to 18 inches of snow.
Okay, you guys
So,
have actual weather in the USA.
yeah. Oh, yeah. Now, how do we pronounce your last name?
It's Al-Ubaydli. Al-Ubaydli.
Okay, cool. Yeah, I would have butchered that for sure. Now, I gave a little intro to what your company does, but maybe you can tell us in your words what exactly Patients Know Best is.
So it's as you summarized, it's a patient-controlled medical record. That means it's a medical record that can receive all your data from all your physicians, like the hospital, the physician's office, the labs, and so on. And then you, the patient, control who gets access to the data. Now, obviously, for the patient's perspective, that's the right way to be treated. But from the physician's perspective, that solves the legal issues around sharing data. And it's much easier to technically share the data if it's all going in one place. So they save money and they deliver safer care. And because of that, they give it free of charge to their patients and they fund it for their entire medical population.
So I'll just use myself as an example, and then we can kind of walk through how this would work. So I find out that I have a blood clot last March. I go to the emergency room and they give me an ultrasound. They find the blood clot. Then I have to go back to my physician. Then I have to meet with all these different specialists, blood specialists, vascular specialists. So how would it work? That was really my first instance dealing with the healthcare system my entire life.
Yes.
Other than the typical go see the doctor every 3 years, just for a checkup. So I really saw firsthand that it is a mess over here. I'm assuming other countries are a mess too. So starting from that first visit where I find out that I have a blood clot, how would it work? Those medical records get uploaded to the system, and then I can share those ultrasound results with all the specialists that I go meet with.
Basically, yes. So I'll give you more details. So first of all, I'm pleased to tell you that the whole world is a mess. It's not just the USA. So, and the reason it's like that is specialization, right? So all the advances in modern medicine are based on specialists and super specialists who are really good at their job. But when they specialize, they know more and more about less and less of you. And so you're left joining up that information across the providers. So you probably didn't know you had a blood clot. You knew you had pain in your leg. And then you go to see someone in the ED. The ED would have done a scan. Then they may or may not have told you that you have a blood clot. But then they would have started by saying, tell us all your medical history. And then the next physician you saw based on that scan may or may not have seen that scan, and they may have asked you what the result was, and you'd say, oh, I think they said it was blood clot, but I'm not sure. But then they also ask you all the questions again about your medical history. And in particular, if you're a woman, are you on contraceptive pills, that kind of thing, right? They go through your medications. It's very important to understanding a blood clot. And then you go and see somebody who's going to fix the blood clot. They're going to ask all the questions, and so on it goes. In a few months or a few years, any other problems you have, they will want to know about what happened in this episode for the blood clot. And odds on, they will not know what happened to you. They will not have the notes. And even if they do, they won't be able to look at them in the short amount of time that they have with you. So they end up asking you everything, and you need to know what's going on. The alternative with PKB is they just open up the system and they see, I see that's your past medical history, that's your medications. Oh, I see the scan, it came through. I see that you have an appointment booked for another physician. And may I have your permission to bring other people to have a look at the whole record? So it's a complete record. It's a real-time record. Everybody's looking at the same thing. So if there are any errors, it's corrected by people rather than left out. and it's under your control, which means even when you get into sensitive areas like mental health or sexual health, you can decide who gets which parts, and you're still left with a complete record that's centered around you as the patient.
Gotcha. Okay. And I mean, I guess the patient knows who they've gone to see, so they probably have a better feel for what should be on the system. So if something is missing, the patient's probably most likely to figure it out, right?
Correct. And it's not necessarily just the patient. So we find often the spouses, the other members of the family are more interested in the patient's health than the patient is themselves. So though you may log in to look at your wife's record with more diligence than you would to look at your own record, but using your support network, so you give consent to these parties and they pitch in, they help you out, and they have the time, right? So you have 8,000 hours a year that you're not with a physician. You are stuck with that medical condition. And so it's in your interest to go in and see what's going on and keep an eye on what they might have missed out. It's also in your interest to see what mistakes they might have made from the little time they have with you. And it's in your ability to get the whole healthcare system to get a complete, correct medical record.
Now, you mentioned in our pre-call that healthcare is approximately 20% of GDP. Is that in the US or is that the UK or both?
It's in the USA. The UK is about 8%. Europe is about 9 to 11%. So the
Why,
US is particularly high healthcare spending,
why,
but not particularly high healthcare outcomes.
why is the US twice as high as some of the European countries?
So you do not have a universal healthcare coverage. So I'm not talking about whether you want to have a single provider or socialized medicine or any of those things. It's just that if you have some of the population who are not covered by medical insurance, but they are provided with emergency cover, they wait until it becomes an emergency, which is much more expensive to treat than if they had coverage and they went earlier. So everything goes up as a result of that.
Right, right. Proactive care is less expensive than reactive care.
Correct.
Um, so talk to us about the company now, where you are a doctor, right? You went to medical school, and did you ever practice? Did you ever have your own medical practice?
So I did 1 year of practice as a family physician rotation after graduation as a physician. But I went to medical school saying I would never practice. I just wanted to learn how to write software and write medical software from medical school. Uh, but ended up enjoying medical practice so much. I did 1 year working with patients. I enjoyed it a lot. But then I went back to the software.
So you're okay, and when did you start this company? I'm just looking back right now. So it says okay, so you guys started like 7 or 8 years ago, right?
We started in 2008, July
Okay.
2008.
And did you actually build the software, or did you hire a team to do it?
I wrote the specification for the software back then. It was just me in the first few months. So I found some developers to write the proof of concept. It was a team in Texas, and then we did a next version using a team in India. And by that time, we began building the team for the company. And now all the developers are in house and they're distributed across the 12 countries that we operate in.
Okay. And it says so back in 2009, you guys raised the first kind of seed round for the company. How big was that round?
That was £50,000. We're furiously updating our exchange rates in the light of Brexit. It's,
Okay. And
it's
then
around $60,000.
and then 2010, you guys raised 1 million, and then 2014, you raised another million, and then where you popped up on my radar was a few months ago, you guys closed on a $3.5 million round. So, what's been your fundraising strategy? I mean, how have in terms of like the specific investors that you were going after, and then how have you guys allocated that capital? Has it gone into mostly engineering or marketing or whatnot?
Sure. So just a couple of corrections which will relate to the strategy. So we raised $5 million and 3.5 million pounds back in 2015, and in the gap between the founding the company in the first few years, the first $1 million, that was self-funded. It was basically founders and family investing in the company, and the main reason for that was that the model that we were bringing, which is the patient owns the data, the patient is in control of their data. that was not only disruptive to healthcare, that was counterintuitive to many of the investors we saw.
Right.
So they were all used to you get as much data in the system as you can, then you monetize it through advertising around it or selling it. And we said, no, the ownership model is that the patient owns the data, so we can't sell it and we don't advertise around it. And so in the early days, not everyone agreed with that. And so we funded it and we proved that actually people want to pay for us to look after the data correctly. There is a software as a service business model where the customers trust us because every contract says the patient owns the data. And the software is built so that every patient's data are encrypted and only the patient has the private keys to decrypt the data. And so that zero knowledge approach to the data storage is a powerful enterprise sell. But it took a few years to prove that to investors because enterprise sales cycle take a while. So the strategy in the early days was get some customers who are valuable, like Great Ormond Street Hospital, Europe's top children's hospital, and then keep the burn rate as low as possible to give us time to demonstrate the value and the traction that we have in the marketplace. And then you can do a raise after that.
This is Jonah Lupton, founder of Jewel and host of the Startup Sense podcast. At Jewel, we help entrepreneurs and startup founders build, launch, and grow their companies by providing superior technology, marketing, and consulting services. We help clients of all sizes, budgets, and industries. We put our clients in the best position to raise capital, grow revenues, hire employees, and maximize their profits. For more information or to set up a free consultation with our team, please visit our website at jool.net. That's JOOL.net. So I'm glad you mentioned the business model because I wanted to get to that. So what is exactly the business model? How do you guys make money? Are you charging the patients or are you charging the medical practices or both?
It's a software as a service business, and the party that pays for the cost of the system is the organization. And in the beginning, the organization meant the hospital. Those were our earliest and biggest customers. Now it's the UK's equivalent of accountable care organizations, so covering the whole population. And we also have other customers like pharmaceutical companies, patient disease organizations, social workers, and so on. All it's based on how much the professional in that organization works with the patient. So how much data they end up having to deal with, how many interactions they have. That's how we price it. And then the patients, they get it free of charge, and they can use it with any outside providers free of charge, and they can unstore an unlimited amount of data for each patient.
Okay. And what are some of the prices that people are paying? I mean, is this $5 a month per patient, $10 a month per patient?
It's a spectrum, but just roughly, it goes from at one end, you start from $50,000 a year for a single department, and then when you get to population, it's a few dollars per year per person in the population. So it becomes extremely scalable at population level.
And what are you guys doing for the medical practices? I mean, is this approach, this new business model, saving them money, saving them time, aggravation, liability? I mean, why do they like it so much?
So the practices like it because it saves them time and it increases the quality and the safety of their interaction with the patient. However, most physicians' offices have a low total revenue, and they lack IT resources to do big data integration. They want to see the data from the hospital, but they tend not to have be the best environment to start giving data to the hospital. So that's why we tend to start in the large organization, the hospitals, and now they're giving it to the physicians' offices in their surrounding area. Because the hospital and the physicians start working very well together. Both of them save money. It just happens to begin at the hospital stage.
Now, say for instance that I want to join Patients Know Best, and I want to start to get my take over control of my medical records. What if my specialist or my doctor's office, they don't want to play ball with this? They don't want to, have to learn the system. They want to do things the way that they're used to doing it. I mean, how much can I twist their arm and get them to, cooperate?
Short answer is not very much at all. And that was one of the reasons we took our approach. So I don't know if you remember Google Health and Microsoft Health Vault when they launched back in 2007. That was their principle, right? So they're going to give you an environment. It's free of charge. You can log in, put your data, and surely that's going to help the healthcare system. And if they don't get it, well, you'll help them get it. You'll explain it to your physician. Now, this is when I was writing my book about medical records and giving patients access. And I spent a year trying to convince hospitals to do that approach. And part of the reason for PKB is I saw why that approach doesn't work and why other approaches previously tried hadn't worked. So basically, you'd hear about Google Health, you'd spend 3 hours writing your medical records manually, and you'd say to your physician, look what I've done. And your physician says, I don't care. I am not going to use this system with you. I have all kinds of liability issues with you having a record that you can delete like Google lets you do. It's not HIPAA compliant, et cetera, so I'm not using what you've done. And basically, that patient turns from being an evangelist for this approach to an enemy of this approach. So we just took a decision not to do that. And although it's slower than we desire, because we want the whole healthcare system to be revolutionized, we have to go through institution by institution, region by region, rather than just opening it up for the patient to kickstart it.
Okay, gotcha. Did Google Health and Microsoft Health essentially fail? Are they even around still, or they've already been shut down?
So Google Health was shut down in 2010. The UK government's approach for patients was shut down in 2009. Microsoft Health Vault hasn't really gained customers since 2011, and they certainly haven't gone beyond their 4 countries, the USA, Canada, Germany, and the UK. So those, it's Microsoft, so they never shut down their efforts. They keep it going. But in terms of it's the Microsoft's, their enterprise, right? The thing about enterprise is you never shut down what your customers are depending on. That's the promise you get from Microsoft. Whereas with Google, if you don't get 1 million users in a month, Google will shut it down. That's their promise for consumers. So whatever the company culture is, there has not been traction in those approaches. And that was, one of the reasons that we took a different approach. And it was slow, but it's now paying off at scale. It just required the patience of dealing with the healthcare system.
Do you have any idea how much money Google put into their Google Health program?
I cannot imagine how much money Google gets to play with. More than I have is all I'm going to say.
Well, I mean, you've raised, a chunk of money here. In order for you guys to keep scaling, especially to the US, do you have a handle on how much more capital you're going to have to raise?
So it's the next raise, this Series B that we're looking at, basically. So for the USA, you need not only proof points in terms of market traction. We'd have basically the things we've been doing for the last couple of years and getting this rolled out at the population scale of millions to convince entire states in the USA to do it. But you also need a big raise and a big US team to get that credibility. And so that's what we're focusing on for the next couple of years.
Okay. Now let's talk about why you have 42 employees across 12 countries. What's the reasoning behind that?
So in the beginning, it was just for me personally, right? So I was coming back from the USA to the UK. I knew I was starting a family, and I just wanted to be able to work from home because I knew how much time a startup takes. So I thought if I can at least get rid of a commute, that means I can just split my time between company and family. But I was aware of 2 things from my time in the USA. One is that my previous employer, they would hire very high quality candidates and they'd give them very high quality training. But they'd lose half of them when the women became pregnant. And when they come back from maternity leave, the company would say, you're welcome back, but you have to work full time and you have to work in the office. And so when they were first coming back, that wasn't the kind of job they were looking for. So I thought actually that's purely a management issue. If we had a way of allowing part-time and allowing remote, that would be a good thing. And then the other thing I was aware of is in the 80s, Citibank, one of the reasons for their growth was they specifically targeted MBA programs because they knew that women were not getting job offers. They were being discriminated against. So they created a team that just focused on finding the women and giving them credible job offers. So I thought we could have access to a wider talent pool if we started that way. It turned out to go way better than I expected. So we got lots of fathers, basically people at the top of their game. They've really gone through the career path in their company. And at the same time, they've started families. And so if you could give them a way to work from home, we were able to recruit people you would not have expected given the early stage that we were at. And then it became really good because we can hire anyone from anywhere. I'm the only person who lives in Cambridge, right? So the fact that we have developers and staff from Australia all the way to the USA is very valuable in terms of convincing multinationals that they can buy us and roll us out across multiple countries. And just in simple things like there's always somebody awake in PKB in some time zone. So for technical support, you can do much more than you could expect given a team of 42 people.
Awesome. What's been your, who's been your best hire so far? You have one person that has really just surpassed your wildest expectations?
I'd say that the answer changes every couple of months as we get someone new. What I will say is, some of our best hires have been ones that we turned down. So we'd say to them, we are too early, too small for you at this stage, or we don't currently have a role that meets your skills, or we're not yet in the right location to benefit from your expertise. And it's the ones who kept on knocking on the door saying, no, I know you guys need me. You just don't understand it yet. And let me show you. And these tend to be very high caliber individuals. And they also get the mission of what we're trying to do. And so it's within a couple of weeks of them joining, you realize, how did we ever manage to run the company without their skills? But it's really wonderful to work with them all.
Awesome. What's been the biggest mistake that you've made? I mean, you've been at this now for, let's call it 9 years. That's a long time. I'm sure you guys have made some mistakes or have some regrets. Could you share some with us?
That's a really long list. One of our investors, she told me this line, which is, wisdom comes from good decisions, and good decisions come from bad decisions. So you just got to go through that learning process. Now, I guess that the one thing I wish I knew back then was I spent a lot of time in the early days pursuing investors, thinking that if I could just convince them, it was worth it. But actually, especially in the early days, if you're not lining up, it's not meant to be. And it's harder not to have investment, but actually it's for the best in the long run. And so in the early days, I wish we hadn't spent quite so many conversations around those and just focused on being with the customer, being with the team. But in my case, there was only one way to learn that.
So your first, official kind of institutional raise was back in 2010 when you guys raised 1.06 million, around that. Do you remember how many investors you pitched in order to raise that million?
Definitely in the mid to high tens. I met I was saying to one of my colleagues, I was in London with him. Every street I walk in London, which is a very big city, somewhere in that street, somebody turned me down for whether it's an investor or a customer. But that is the only way, right? You meet a lot of people, and one of the things I found is just because somebody doesn't give you money as a customer or an investor, it doesn't mean that you can't benefit from working together. Right. So you stay respectful, you keep the conversation going, and something always happens in the long run. But there's a lot of no's. But on the other hand, you only need one yes.
What are you the most proud of so far?
I have to say, actually, it's the people we work with every day. It's just a real pleasure. So they all get what we're trying to do. I mean, when I started, I thought medical records, they were obscure and boring, but you will not believe the politics that we get into and the problems that we have to solve every day. But we have a team of really, each of them is highly obsessed with this problem. And to be able to have found them and recruited them, it's a real pleasure, because you just turn up with them every day, and they're all fighting for that patient. They're all fighting for the patient to have their data and to understand their health.
Yeah, I mean, certainly, I come from financial services. That is a massive industry, very complex, a lot of moving pieces. I would put healthcare in that same category. Um, and especially as people age and their health becomes more important and more issues arise. And, like I said earlier in the call with my blood clot, I mean, that was the first time I've ever really gotten a dose of what the healthcare system looks like, functions like, and it was a big disappointment, and it still is. And
Yes.
there's, we need more companies like yours that are going to try to fix these problems.
I mean, for me, it's the possibility of the impact is enormous, right? So, I mean, just to give you an example, the bailout for Portugal from the 2008 crisis, the bailout from the IMF and the Troika and so on. Part of the bailout requirements weren't just, fix your banks and so on. It was that medical records must be electronic. They must be digital, right? So because healthcare affects entire economies, the USA is 20%. The rest of the world is still 10%. It's massive, the change you can make. Not just obviously saving lives, literally saving lives, but you're 10% of every advanced economy. That's huge. If you can just make it a small amount of improvement, that is a massive amount for the whole country. It's the analogy we like to make is for telecommunications in the 90s and noughties in Africa. So you could track that for every extra percentage point of telecoms, mobile telephony penetration in an African country, there would be a big increase in the GDP for that country permanently, right? Because everything is being transformed. And so that's the scale that you operate in when you reform this system.
What is your number one goal for the rest of 2017?
It's proving this working at multiple population scales. So 2015, 2016 we got our first population contract. That was the first in the world where the entire population, the patients were placed in control of their medical records. And when we got that was huge. Nobody else had done that before. But also there was always the question, was that a one-off, and was that an experiment that may not work? It has worked, and now it's about putting it in several cities and regions across the UK, which means in 2018, you can just go to entire nations and say, or entire states in the USA and say, why don't you run your state in this way? Why don't you give your citizens the power? Why don't you improve your healthcare economy spending?
Now, in the UK, and I'm not sure how the UK and US will be similar. Maybe they will, maybe they won't. But in the UK, with regards to your marketing strategy, are you going after the patients or are you going after the practices?
So in the UK, we're definitely going after the providers.
Okay.
It's explained to them how they do look at their patients, but also they save money and they increase safety. Right? The cost cutting and quality improvement are the two metrics they go for on the enterprise side. They would like to make patients happier, but those two things are the ones they care about in government-funded healthcare system in the USA. When you go to countries like the USA or Germany or the Netherlands, which are much more private healthcare funding, it's about this will increase your revenue because you attract patients, and you do that because you improve safety and you improve patient satisfaction. It's still the same mechanism to get there, but you just highlight different things when you speak to them.
So going after the providers, how long is that process? I assume you're not reaching them through digital marketing channels, right? So you guys are actually having to go to these providers face to face or call them on the phone, however you reach them, and then how long does it take them to convert them over to your platform?
So it used to, literally used to take years when we first began, right? Now it takes about 3 to 6 months. It still takes a few months because they're giving you all their data, right? They're moving it from their basement to your data center, and it's with everybody else's data, and that takes them a while to trust. But once they trust, when that super tanker turns, it's massive, and so it just takes several meetings over a period of months to gain that trust from them.
How many other companies out there are doing what you guys are doing?
So in terms of putting the patients in control of the whole record, um, at the moment nobody's doing it. Which to me as a patient, it's depressing, right? Because when I started, at least you had Microsoft and Google, and even the UK government was pushing it at some point. Basically, all the startups went bankrupt, and the big guys just gave up. And even Microsoft, although they're around with their Health Vault offering, they converted it from a patient-controlled medical record system to a wellness platform where you can just synchronize your iWatch with your footsteps. Right? They're not talking any longer about all your labs from your hospital, which is sad. But the reason they did that is that it's a very difficult. There's so many things you have to get right, and if you don't get any of them, then you're in big trouble at big scale. And so the reason we win contracts right now is they can't find anybody else who is doing this and who has the experience of having gone through all the hurdles successfully and delivered it at scale.
So whenever you raise money, one of the questions the investors probably ask is, what's the end game here? So I'll ask you, what is the end game? I mean, obviously, I know you're going to try to scale this as big as you can, but is it to remain independent? Is it to someday get acquired by a large, potentially enterprise company like a Google or Microsoft that, kind of took a shot at this and failed, and maybe they're looking to try again? What do you think the end game is?
So from a company mission, I mean, our mission is literally our name. It's patients know best. We always say it's not necessarily a declarative statement, but it's definitely a mission statement. Patients may not necessarily know best, although quite a lot of them do. But by the time we finish with them, they will. They will have all the data. They will have all the people to make a decision with, and they will know best. And what we say internally is what we want is everybody with a body to have a PKB account. So that's the end game for us as an organization. In terms of from an investor perspective, there's certainly ways in which a large company could find PKB a very attractive acquisition. You could scale that up, everything that we've done, combine it with the enterprise sales base that they may have. But also the company, it's a profitable enterprise SaaS offering. So it's perfectly capable of being an independent company and going all the way to IPO.
Awesome. Anything we skipped over? Anything that you wanted to get a chance to mention that I forgot to ask?
I just find the sector really interesting in the sense that what you're talking about right now is you're changing how the way healthcare is delivered. So we're basically built on 3 individually mad ideas, but they make sense in aggregate. So we're saying that the patient should be in control, and the physician should be grateful the patient is in control. And the physician should be so grateful they should pay to put the patient in control. Now, we do that by showing them why it's in their interest. But once you do that transition, it's for me, it's like the Lutheran Reformation, where you're putting the laity understanding information that's no longer in Latin, and they understand what the medical record means, and they can make decisions by themselves. I think that's a massive democratization, and it's a pleasure to be involved in it.
Wonderful. Well, I'm glad you guys are doing what you're doing. I wish you were a little bit more exposed in the U.S., only because I know we need it so bad over here. But obviously, you guys are on the way, and once you officially launch in the U.S., I'm assuming after you raise another round of capital, feel free to come back and tell us all about it.
It would be my pleasure. Thank you very much for interviewing me today.
Thank you so much for your time today. Greatly appreciate it, and wish you the best.
Take care, my friend. Bye-bye.
Thanks, sir. Bye-bye.